Esme. So our last speaker is Anne Lebaq from Vlaams Instituut Gezond Leven, which is the Flemish Institute for Healthy Living. I was going to say it's a governmental organization, but I checked the website and it's not. So they are an independent knowledge institute that provide a lot of information, but also very hands-on tools on health in a broad sense, health and healthy living. And Anne is actually a specialist in food and health. And recently, she and her team developed materials that can support social food initiatives like food banks and community kitchens in how to support your clients in eating healthy. So we thought that was very relevant. So Anne is here to tell us a bit more about that.
Hello, everyone. Thanks for having me. I will try to share my screen. Yes, is everybody seeing the presentation? I will put it in the right mode. Yes, I will try to switch. Okay. So hello, everyone. I will briefly present a project we've been developing for a few years on healthy food and drinks for social food initiatives. I won't go into the food triangle because Fran already mentioned it, but this is a product that's, well, I would say the Institute is the most known for. But so as I said a few years ago, we also decided to have a look at social food initiatives. Just to make clear, the definition we use is very broad, so all kinds of organizations that provide food items or meals freely or sell them at a very reduced price to people in a difficult situation. And so why did we choose to address these initiatives? Because it is literally a place where these people in a difficult situation are confronted with food. And so we think it is a very nice place to make sufficient and affordable healthy food more accessible for these clients. And we decided to do this through the empowerment of the people working in the initiatives. We are, yeah, I would say we speak about working, we have more of a desk job in Brussels. So for us, it's easier to reach out to the organizations than to really reach out to the people in difficult situations. Other people have more expertise on that. But then on a second level, we also have as a big aim of the project to get food inequity more on the radar of preventive health professionals, such as nutritionists, but also on the agenda of policymakers and politicians. Because in our impression, it is a topic that is not yet very well known or well documented in Belgium. So a few years ago, we decided to develop some materials for social food initiatives on healthy eating, but we didn't really know what was already happening in the initiatives, what was possible, but maybe needed. So we started with a needs assessment survey. Online, we reached about 85 people working in initiatives. And then we also decided to really visit 10 different initiatives, all different kinds, social shops, social restaurants, food banks. And there we did in-depth interviews with employees and volunteers. And we also did a screening of the food or meal assortment. We got some interesting results, and very briefly, so the employees and the volunteers, they told us that they need more information on cooking and eating habits in different cultures. So this was something that was difficult for them to find information about, and they got a lot of questions from clients about this. And then in the Belgian context, we are mainly speaking about new clients that have a Muslim background. So the workers needed information on that. And then, as we've already seen with the previous speakers, also, of course, information on budget-friendly nutrition and also recipes. Then there was something else that I would like to share with you. In Belgium, tap water is drinkable, but the organizations, they saw that about 1/3 of their clients, they are really not aware of this. And I saw this with my own eyes during a heat wave. I guess it was the summer of 2019 in Brussels. I really saw people coming from social food initiatives with lots of bottles of water. It's a big effort, it costs money, so it was really a pity that not everyone is aware that tap water is safe in our country. And then a final point is that the employees and volunteers, they notice that when they go look for information themselves on the internet to help their clients, they find that this information is not really suitable. It's too complicated. They find recipes, for example, that are not budget friendly, or recipes for which you need really a lot of utensils and cooking facilities, and they know their clients don't have these facilities. So that's why we took all these results and input, and we started developing our own materials to help out the employees and volunteers, and through them, the clients of the social food initiative. I will briefly go through the materials. Of course, everything is in Dutch. So we started with developing a web page where all the information materials can be found. And then for the materials themselves, one of the first things we made was a brochure on healthy and budget-friendly food. So we give a lot of tips and tricks on how to plan your shopping trip, and how to do the shopping itself. And then afterwards, also tips and tricks on safe and healthy cooking. We also tried to broaden the perspective of some people working in the initiatives, and we added some information on the psychology of scarcity, to show that it's not only a question of money, but often the mental space of people living in poverty is very limited, and just thinking and planning healthy meals is incredibly difficult. So that was a first thing. And then we made some materials specifically for the shopping context, and other materials for the more restaurant context. So we made a guide for healthy meals. We make this also for schools and for companies. And now we decided to make a simpler version where people can easily find the information, and just where they can read one topic they're interested in, because we also know that the people working in these initiatives, they don't have a lot of time, and they're spending most of their time really helping the people. So reading up on stuff is not very easy for them. Then we also, regarding the eating habits in different cultures, we made a separate brochure on what we call super diverse and healthy food. And there, for example, one thing I would like to mention, we also talk about vegetarian meals or soups, for example, because if you make a vegetarian soup, it is suitable for people following a halal diet. It is also suitable for vegetarians. And it is maybe something that I would say an older white clientele will get used to easier than, I would say, giving up the piece of meat in the main course. So we really try to place ourselves in the place of the employees, and not make things more difficult for them. And we also have a guide on healthy shopping. And there, we already talked about it shortly in the breakout sessions. We also give some nudging tips. How can you make the shopping environment in such a way that a healthy option becomes the easy one? We don't want to give the message that people going to these social shops shouldn't be able to buy unhealthier stuff, but sometimes in these social shops, they spend budgets on giving a range of 20 different chocolates and chips and everything Then we give the advice, maybe reduce this choice, give 10 options instead of 20, and use a little bit of extra budget to have a more healthy assortment also. Then for the social shops, we also have a brochure on super diverse food. But then the last material that I would like to show you is for the clients themselves. So we made these very small sheets where on the front you have preparation and preservation instructions for a vegetable or both. And then on the back you have a budget-friendly recipe. For example, you see on the right image for leek. These recipes, we get them from an app and website that our institute developed for the general public. But in the app and website, we made some adaptations for the social food initiative. So we made sure that all recipes are printable so that, for example, a social restaurant can make a recipe. And if people like the recipe, they can take out a printed version and maybe try the recipe at home. There is also a filter option added in the application for budget-friendly recipes to make it more accessible for the initiatives and for people living in a difficult situation. Then we also, as I mentioned, try to give more information on our website on related topics. So we have a lot of information on food inequity. This was launched quite recently. Broaden the perspective of all kinds of people, also hopefully politicians, as I've mentioned before. We collected a lot of information on eating habits in different cultures, way too much to put in the brochures. So we also created a web page with additional information. On these different materials, we always ask for feedback because that's maybe important to mention. The plan was to develop one material and then go testing again in an initiative, but with the COVID-19 situation, I was just sitting here at home developing all the materials. So once everything gets easier and we can come out again and there is a little bit less pressure in the initiatives, we'll go and visit them and check out their feedback. And then a final webpage on the advantages of tap water, because it's really a pity that not everyone is aware of it. Okay, I think this was everything.